Well, of course, researchers are constantly looking for ways to find and cure cancer. And tonight there is word that Google's secret lab, Google X, is essentially developing a pill that could help doctors find tumors in things like, say, an imminent heart attack. Joining us to talk about this is Dr. Sabrina Fabi. Fabi, this is fascinating. A pill that could help detect cancer. Explain this to me.
It's so exciting. Honestly, being a physician, it's nice to have something that might actually be revolutionary in cancer. And so what it is, it's a pill that has little magnetic particles. We're talking nanoparticles, 1/1000th of a red blood cell, so very small, that would essentially be taken perhaps daily, perhaps weekly. We really don't know. It's very top secret. But the point of this pill is that depending on what Google decides it wants to detect, it could detect specific molecules that sometimes cancer cells end up showing on the top of the cell that it could detect. And then by wearing an externally applied device, it could actually tell the body or tell your doctor if there's particular levels of this cancerous cell that may make you want to do something more aggressive, like a biopsy.
That is incredible. You said it, revolutionary. You know, it's so interesting. When you think technology and you go back, say, 30 years, man, has technology changed in 30 years. But the reality is in medicine, certainly some things have changed, but the ER is still the ER, right?
Right. You walk into an ER sometimes, or even an ICU, and it really seems like some of the devices that we're using aren't that much different than what we were using 20 or even 30 years ago. And so perhaps even though we've been drawing blood to detect certain levels of things for the last couple of years, is that really the best way to detect something? And so it's nice to see that maybe we have to think differently when we're trying to detect something, that perhaps it's not an angiogram or something more aggressive or invasive that would do the best service for our patients. And maybe we can just do it with a simple tab that we take.
So in this example, let's just say that the pill gets through all the rigorous testing and clinical trials in the FDA. Would it sort of work like, say, if I had high blood pressure and I was at risk for possibly a heart attack, that I could take this pill and it could sort of tell me when I could have a heart attack?
Well, it's really top secret. You know, I try to do some research on it myself to figure out what exactly it could detect. It would be great if this one tab could detect a slew of things, whether it's high blood sugars, certain molecules that only cancerous cells actually emit, or even little atherosclerotic plaques in your blood, in your actual blood vessels, that could tell you if you're going to have a heart attack. So it depends how good it's going to be able to detect everything in just one tab. But yeah, that would be the goal. And so how nice would it be for a diabetic to just take a tab every day, and then it would beep or maybe, you know, emit some type of signal when the sugars are actually high, versus actually having to prick yourself and draw your blood to be able to detect your blood sugars.
That is just incredible. Let me ask you, just in your expertise in the medicine world, what do you think the reality of this pill is to really coming to market?
I think it's actually quite possible. I think that that's really what the promise of medicine holds, is something like this. We really need to, you know, move forward with how we're detecting and how we're even looking at things. So I think it's possible, but unfortunately sometimes in being involved in clinical research, I can tell you that a lot of clinical trials have to be done, and they have to be very rigorous and actually show not only efficacy but a high level of safety, because these nanoparticles have to be eliminated by your kidneys. And so at what levels do they become toxic? We really don't know. And so we'll have to probably see a lot of clinical trials, and then by that point also an FDA approval, which you know, takes a little bit of time sometimes.
Yeah, a little bit or a lot of time, certainly. But it's at least an interesting topic and may give us hope for the future. Dr. Fabi, thank you so much. We appreciate it.
Thank you for having me, Jen.